So now I want to talk briefly through measuring child wellbeing in the GUIDE survey and what we have done so far. And here you can see an absolutely incredible list of activities that have been done, not just by myself. In fact, I only came into the GUIDE study relatively recently in 2019, but by my colleagues who have developed the GUIDE over the last 10 years. And here you can see from the foundations of starting to think about measuring child wellbeing, there was a lot of participatory involvement. We did a stakeholder Delphi. We did expert interviews with academics, NGOs, policymakers. We've also had youth advisory boards operating throughout the study. We've done horizon scanning. We've done a systematic review of wellbeing measurements. And in the earlier projects that were supporting the development of GUIDE, we developed a prototype questionnaire. We've done work on conceptual perspectives and questionnaire design very recently, and I'm going to present that to you today. And then after my presentation, Tony Babarovic will talk you through the questionnaire piloting. And what we're going to do next after we finish this piloting is we're going to do more in-depth investigations into the measurements of well-being. And then that's going to be published as part of our open access book that will be coming out in the next 2 years. And then following that, then we're going to go and do the proper first wave of data collection in 2026. So as you can see, it's a very long process of measuring well-being that's being done in a very participatory manner with some of these partners in different countries. And you can see here that we really do have a international set of experts who are working on developing our perspective on measuring well-being. It's not just coming from one country or from one culture. And the experts listed here are from all different disciplines. So we have people from policy research, sociology, economics, psychology, and a little bit of anthropology as well, and from survey methodology research. So we really are approaching this in a way that I don't think many other consortium internationally have approached this problem of measuring and defining well-being. So how can we start? One of the starting places of any cohort study is in creating a conceptual perspective around what you're doing, around how your study approaches measuring well-being in a child population in a way that's going to be sustainable over the life course of the survey, so that you're going to be able to identify causes and outcomes in relation to this key concept of well-being. And from a review that we did for the Department of Children in Ireland last year, we reviewed other cohort studies' conceptual perspectives. And you can see that there's a range of conceptual perspectives that birth cohort studies adopt in their design. And one of the things that brings these together is that really the cohort study conceptual perspectives are trying to identify inputs and outputs, what you might call outcome dimensions and impact dimensions, and they're trying to work through a theory of change. How is it that well-being changes in the life course? How is it that well-being influences outcomes in the life course? So these theories of change are not as explicit as you might imagine. In fact, there's no really, really well-defined theory of change that can be translated into a statistical model in these birth cohort studies, because the theories of change are very broad. So in the GUIDE, we've had a lot of discussion about children's well-being and how to measure it. And part of our conceptual perspective is that we are drawing on many of these different types of theories of change that have been used by the other birth cohort studies. And because we have such an interdisciplinary perspective, really, we do need to consider many of these, such as biopsychosocial development, life course theory, risk and protective factors, early life exposure. So bringing all of those perspectives together. And of course, when you're thinking about the impact of the environment on children's well-being, we have to consider all of these different dimensions So family, home, schools, etc. And when you're thinking about the person, what are the different aspects of lived experience that are feeding into well-being? And what does well-being look like within the person? So is it psychological well-being, hedonia, eudaimonia? Is it biopsychosocial functioning? Is it genetics? Is it physical development? What is it? And one of the things which I'm particularly interested in is dynamical systems. And now you're going to have a flashback to the oranges and the motorbike. And how can we work that into these conceptual perspectives around measuring well-being? One of the really great things that a dynamical systems perspective can contribute in thinking about life course theory is about the role of the environment in shaping the individual life trajectory. And no, it's not easily measurable. And yes, it is theoretical, but things that can become measurable need to have a good theoretical foundation that in itself can't always be directly translated into statistical measurements, because these are what we call broad meta theories about the way that humans develop. So here we can see Waddington's epigenetic landscape of development, where the balls are rolling into channels. And if you think about a structure in society, like an educational qualifications framework, as providing the walls of these this landscape. And then the individual channels that the ball rolls into can be broader, for example, in a comprehensive educational system where young people can move from one track to another fairly easily, or much narrower, like in a tracked educational system where the young person is early in a certain kind of track, educational or vocational, and the way that this shapes life outcomes. So in the guide, taking us back now to what we are actually measuring in the survey, so from the deep theoretical perspective of how human development works through into a domain-focused specific perspective of what we can measure, this is what our team of international, interdisciplinary scientific experts came up with. So here in the middle, we have well-being as defined as hedonia and eudaimonia. So from the philosophical aspect of well-being. Then around that, you can see the functioning. So physical, emotional, cognitive, behavioral. And I should also put biological in there, functioning. So that would be like the internalizing, externalizing mental health, or physical well-being. How fit are you? How daily active are you? Then we have this yellow ring here, which is coming from sociology, which is not really well represented in many measurements of well-being, which is a person's experience of their lived environment. So how included are you? Do you feel that your voice is recognized? Do you have a perception of feeling that there's equality in your social environment? What's safety for you? Do you understand your rights and can you enact them? So this is not often looked at from a well-being perspective, but it is the intersection between the person and the environment and their experience of the environment. And then the wider ring here is about the context. So these proximal developmental contexts. And this slide just shows you the same model, but in a more grid shape, so that we can see here that the things that we're measuring are in black, the things that we would like to measure are in red, but that we're not currently measuring in our pilot questionnaires. And it may be that we can get at some of the things in red through linking data, through aggregate data that's measured at a population or a local level. And it may be that we can integrate some biological measurements. We're doing an investigation of that right now. And of course, those would allow us to look at genetic data.